and right now, again, we don't have anything in Lafayette, but possibly in the next couple days to a week or 2 weeks, we're going to maybe start to see a spike in incidence of this virus.
Welcome back, everybody, for our coverage on the coronavirus here in Acadiana, and I'm really excited. I've got my brother-in-law, Dr. Bradley Chastant II, who works at Lafayette General and is on the front lines with the coronavirus here in Acadiana. Bradley, thank you for joining us.
Thanks for having me again, Jim.
Super crazy day, huh? I mean,
it's been a crazy week, last couple weeks.
So tell us, where are we at right now with the coronavirus, and what's the plans moving forward?
Well, obviously we're seeing more and more numbers in the state. Thankfully none here in Lafayette just yet. But I mean, we're still being vigilant about screening and being proactive about keeping our community safe, and we're just doing what we have to do to keep this virus at bay.
So tell us, I know that you've actually already screened a few people personally. Tell us what that process is right now.
Well, our office, we have it set up to where we have a quote-unquote drive-through type of screening process. The patients will call the office. It's not just a first-come, first-served deal. They have to call the office, get scheduled to be able to get quote-unquote screened. They have to meet certain criteria.
Screened is not getting tested.
Right.
Okay. Right. I think there's a difference between screening and testing, correct?
Absolutely, yeah. So, you screen to see if you're at risk, and screening to be the front runner of, the first look at this. And then, once we screen and we deem that you may be a candidate for testing, then we will test you. So screening, the patient will call the office with certain symptoms, fever, over 100 degrees Fahrenheit, cough, shortness of breath, exposure, immunocompromised state, people on dialysis, on certain medications, et cetera, et cetera. Over the last 2 days, we've had probably about 15 people that called the office that kind of met the phone call criteria to be screened. And so what we did was set up a time frame in our office, not in the office, but outside the office in the driveway, parking lot. We had a little station set up to where myself, a nurse, and my office manager would perform the actual screening setup.
Right. And y'all are like in full hazmat suits, and
we're in our proper PPE gear. We have,
of course, the PPE gear.
That's right.
What does that mean?
PPE is personal protective equipment, and which is an N95 mask or L3 mask, impervious gown, eye shield, obviously gloves.
So basically, you look like you're on ET going to.
I feel like I'm screening ET.
All right, cool.
But so we had probably about 15, and out of the 15 over the last 2 days, I've maybe screened 3.
3?
Yeah, that met proper, or tested 3 that met proper criteria.
None of those tests are back at this point, right?
No tests are back. They have tests that are supposed to come back within a certain period of time, but because the screening facilities that do the test are so inundated with tests, the time frame is going to be a little bit longer. Right now we're looking anywhere between 4 to 6 days.
Okay, well, let's talk about screening and testing, because our mayor president just told us that they're going to be setting up testing, screening and testing at the Cajun Dome tomorrow. Give us an idea, like, what does that look like? Okay,
well, our 2 main hospitals, Lafayette General and Our Lady of Lourdes, have actually come together to do this, excuse me, to do this screening tent. Again, this is screening, not just for testing. You have to meet certain criteria to be tested. They screen the patients for symptoms, for exposure, for what have you, in order to be tested. Please, 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 if you do not have symptoms or just been exposed or whatever, mainly just symptoms. If you do not have symptoms, do not go. This place is going to be inundated with patients. It's going to be hours potentially of testing.
So you guys are actually expecting and anticipating a ton of people showing up just to get tested. They think they're going to get tested, but they're going to get probably screened, and then only if you make it through the screening process are you going to get tested?
Right. We only have a certain amount of tests available by way of the CDC national shortage. Obviously, this is a big national problem, international problem. We only have a certain amount of tests for the time being. So if you do not have symptoms, please do not go there to expect to get tested because you have to meet certain criteria: fever, shortness of breath, cough that has worsened, flu swab negative. In fact, today we had a lady came by with low-grade fever, some shortness of breath, cough. We actually diagnosed her with the flu. We did a flu swab first. She was influenza A positive. So
if you have the flu, you don't have corona?
Right.
That's true. Okay. So you can't have corona and the flu at this point, as far as you guys know.
Right. And right now, so if you test positive for the flu, we would treat you for the flu and not screen you for the coronavirus. It's not necessary. And so, right now we're still trying to say, look, if you don't have symptoms, don't go over there. Same thing with the emergency room, walk-in clinics. Do not go there if you don't have symptoms.
Okay, so let's talk about a little bit of the, last time we talked, you mentioned that the coronavirus is highly contagious and it can stay on surfaces for a long period of times. Like, what are those again?
Coronavirus in air, since it is a droplet type of medium, about three hours in the air. On surfaces, it can be anywhere from a couple hours to a couple days. Especially plastics and things that are porous surfaces, they can last a lot longer.
And how is that different from the regular flu? The
flu can last anywhere between a couple hours to maybe 48 hours on surfaces like bus poles or handrails, door handles, etc. So the coronavirus seems to be kind of lingering around a little bit longer.
Right. Well, I know at our office, we're taking extra precautions after every meeting in our conference room. After every, we're wiping down everything as much as we can, keyboards, mouses. So we were talking about testing a second ago, and we know tomorrow's going to be a big day. I think, like when you say test, because you mentioned when you get the flu test, it happens immediately.
Right.
Like you get swabbed and then you put it in a little thing and then hey, you got the flu or not. How is this going to be different from the flu test?
So, right now the coronavirus, we don't have at our disposal a rapid, what we call quote unquote rapid test like the flu. You can go to your doctor's office, walk-in clinic, swab for the flu. We'll have a test answer within 5 to 10 minutes. Well, this one, unfortunately, is days because of the testing sites are just inundated with requests right now. I think we're at, over quite a few hundred cases. I can't remember right off, but
oh yeah, we're just under 200 cases confirmed. And I think there's 700 tests that have been taken.
Probably more.
Yeah, probably more than that. But that's what on the CDC website as of a few minutes ago. So it's not going to take. So here's what I think could be an issue. Whereas when all these people start getting tested, obviously we're going to have more people test positive for it because there's more tests, right?
Well, the more tests you do, the more chance you're going to catch something. Now does that necessarily mean that you have to be screened or tested? No. Again, if you're not a high risk patient, not symptomatic, do not get screened because there's no need to because of limited supply.
And so tomorrow we're going to test a bunch of people probably. That's going to be the start of it, and then we're not going to know for 5 to 6 days whether or not they're positive or negative.
Right.
So when those numbers start coming in, is it possible that we're going to have a lot more cases showing up? And should that be a concern for us? Does that mean the virus is spreading faster?
Well, I mean, maybe not the virus is spreading faster. Maybe it's just coming closer to us. Everything's been in New Orleans, around East Louisiana, lower East Louisiana, and it's going to slowly trickle this way. But now that we're starting to test, because of certain patients that may have symptoms, we may, in the next couple days to weeks, start seeing a spike in the numbers that test positive here. It's just a matter of population,
Right. So, I mean, it's been pretty scary what's going on, like just in the economy in general is what I'm saying, because obviously we have not been affected. We don't have any reported cases of the coronavirus here in Lafayette yet, which we're expecting it to happen. But when you're looking at some of the numbers, I was just looking at the CDC website, the United States has, approximately 330 million people, and since October to February, we've had over 31 million cases of the flu this year alone, with 12,000 people who have died just from the flu. Whereas in China, if you believe their numbers, they've only had 198,000 people with a population of 1.4 billion that have contracted, or what they're reporting, with the coronavirus, and they're supposedly on the back end of that.
Right.
And they've had almost 8,000 deaths. So I'm just, it seems pretty drastic, the measures people are going to, what we're doing right now to shut down everything to prevent, so much less numbers based off of the numbers that we're reporting from.
Right. I mean, everybody's being proactive against this, obviously, to kind of lessen the numbers and to, quote, flatten the curve. Yeah, I mean, it's a pretty virulent, pretty potent, pretty virulent virus. I mean, the flu is just as as widespread as this. But again, as we talked about in the previous podcast, the previous discussion, practice good hand washing, hygiene, that kind of stuff to kind of minimize the amount of spread that this virus can potentially wreak havoc on. And right now, again, we don't have anything in Lafayette, but possibly in the next couple of days to a week or 2 weeks, we're going to maybe start to see a spike in incidence of this virus. And
we should see that. We're expecting, is what I'm saying. Right. We don't want to see that, but we're expecting to see that. So there's no reason to get alarmed by seeing an increase of cases here in Lafayette.
Right. Yeah, and we will see a spike. That does not mean to get more and more nervous about that. We're actually expecting a rise in numbers in the next few weeks. But again, the government, the national government, the local government, the communities have actually taken precaution, taking kids out of school, shutting down certain areas of gatherings, kind of minimizing the potential for spread of this virus. If you can kind of curtail the vectors, then the incidence of this virus may go down, hopefully.
So when are we going to know we're on the backside of this? I mean, what are you guys talking? I know you're having meetings constantly about the coronavirus and what to expect from your standpoint. What should we expect as the public to know when we're on the backside of this, when we're coming down?
Well, I mean, just stay informed. There's a bunch of websites that show us the incidence of this virus, how many confirmed cases, etc. And so, again, I hate to bring up that whole flattening of the curve thing, but that's the reality. What you want to see, to answer your question, is you're going to see a spike, then you're going to see a plateau, and then whenever we see the back end of it, that's when that curve starts to drop off a little bit. And hopefully that happens sooner than later.
Well, and even some of those spikes that we're seeing right now in the other states, it's not like it's hundreds of thousands of people.
Thankfully.
Thank goodness. We have a population here in Louisiana of 4 million people approximately. So, if you use some of these numbers that China has reported, we're looking at, a potential of 560 cases in Louisiana if those numbers are correct.
Yeah, 1% to 2%. As far as 1% to 2% contracted cases, positive cases compared to the death.
Right.
So maybe
death. 1% to 2% of people who get it could die.
Right.
But the people who get it, you're at 0.014% of our population that could be at risk. Now, whether or not there was preventative measures that were taken in China that reduced that, but that's what China's numbers are,
right?
According to, if you believe anything they say.
Speculation,
right,
at best.
So, what is the one thing you want to leave us with that we need to know moving in the couple of days, in the next 3 days? Things are changing by the hour. What do we need to do?
Stay vigilant, stay smart about this. Keep your hands washed. Try not to touch door handles. Elbow bumps. Kid and play. Foot shake. To kind of go back on the last podcast. However, also with that being said, we do have screening stations out there. But please, 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 if you do not have symptoms, please don't bog down the lines. Please don't let somebody else that may actually be at risk, that needs to be tested, be denied or waiting for the test. Again, no symptoms. Don't go test. Don't go to the emergency room. Don't go to walk-in clinics. Again, to reiterate what we said on the previous podcast, we have a saying: if you have never heard of this virus and you're feeling symptoms that you're feeling, do you still think you need to get it checked out? You know, for example, mild, short of breath, allergy symptoms, sinus infection, whatever. You know, if that's the case and you're not severely ill, please don't get in the line to get tested. If you have symptoms, obviously short of breath, fever, cough that's progressively worsening, flu swab negative, whatever you may have, you know, dialysis patient, immunocompromised patient that are on medication or their immune system's low, yes, certainly go get in line, get checked. We're doing this at our office. We're doing this through our 2 big main hospitals here in Lafayette. Also, too, please, if you do get in line, and the screening physician, nurse, or mid-level or what have you says that you do not meet criteria, please don't get upset, because we're going on CDC guidelines. We're trying to save the amount of testing supplies that we have.
Right.
So please don't get upset if they say you do not meet criteria. Because that's just going to make...
It's nothing against you.
It's nothing against you. It's just that means you're at low risk, thankfully. So, I mean, if you don't need to be screened, that's actually a good sign. So please don't get upset if they decide you don't meet criteria. But again, no symptoms, please don't get checked. Don't go get in line, don't go to the ERs, etc. But if you're having symptoms, obviously go get checked. And again, if you have severe symptoms to where you can't breathe, having significant shortness of breath that's progressive, please go get it checked out, whether it's through an emergency room, whatever. That's with severe symptoms.
Great advice, man. And I know we got to go, but I just thought of a couple of things I wanted to ask you, because some people are dealing with this. Like, what do you do, or what do you recommend when somebody in your office, if you are still working and you're still going to work, if you only have a few people at your office and you show up, one of the people at your office, people close to them have gotten it. What do you suggest? I mean, do you suggest isolate yourself just because you've been around somebody like that?
Yeah, be smart about it. Obviously, everybody's talking about social distancing, 6 feet. That's going to minimize the amount of potential spread. In our office particularly, we haven't seen patients for our wellness and checkup visits for the last 2 days. One, we don't want to have a potential exposure in our waiting room. We have a very big waiting room, and if people sit next to each other, coughing this and that, there's a potential for spread of this. So right now, we're not seeing our wellness checkup. We're seeing people that are sick, but we do now have at our disposal telemedicine. They actually came and set up telemedicine in our office Monday. They started implementing this on, I believe, Friday, but we have the ability to talk to you through the app that was on our previous cast called Health Anywhere, LGH, or LGH Health Anywhere. Also, you can call the office or call your provider, because there's, I believe, about 90 practitioners here through the Lafayette General System that has actually requested telehealth, telemedicine.
Yeah.
So call your provider. They can set you up with an appointment to do teleconference. Also, the president has actually decreased the
amount of people to be in.
Well, not so much the amount of people, but the
assembly.
It's the laws, for like healthcare.
Oh, I see. Restrictions
for HIPAA, this and that, to where you can actually use a lot of the doctors are using cell phones now with Skype through this company, through this media. It's still secured, but we now have. Before, we weren't able to use our cell phones to directly talk to you because of HIPAA potential violation.
Okay, so they've reduced that.
Yes.
They've opened the gates for you guys to actually treat your patients virtually, without more restrictions.
Right. We have iPads. We have those things in the office.
Yeah.
We can use our iPhones now through a secured medium, but we have that at our disposal now.
Man, thank you so much for being here tonight, and I hope you don't mind. We're going to keep checking in with you throughout this crisis.
No, absolutely. Keep me informed, or I'll keep you informed, and take it from there. Stay safe, everybody.
Stay safe. Keep up to date. Check out the websites, and if you are experiencing symptoms, you're going to be able to test yourself or go get screened and tested tomorrow.
Absolutely.
So we'll keep you guys posted as we move through this crisis, and hopefully we get to the back end of this in about a week, I would hope.
Well, unfortunately, it looks like it might be longer than that, but hopefully I'm wrong.
All right, 8 days.
8 days.
All right. All right, signing out. See you.